we're excited to get started with this panel to talk about what's happening in healthcare and how access is being expanded and managed and things like that, and how we are building workforce and that type of thing as well. So thank you everyone for being here. I see some familiar names and I'm glad to see y'all. We are very pleased to have with us Michael Kellerman, who is with Providence. He's the new chief executive there. Basil Saeed, who is the CFO at Providence. Dr. James Goldberg, who is the interim assistant chief medical officer. Is that correct? Is that
yes.
Okay, great. So an extended title. Wanted to make sure I get it right. He's at Providence also. Nancy Stark is with DHHS, and she works on policy and some other things there. Rosemary Denowden is the CEO of Humboldt IPA and Inchin. So a really good diverse representation of our healthcare community. So I'm Nancy Olson. I'm the CEO of the Greater Eureka Chamber, and pleased to be your host today. This is our sixth Conversations with Leaders session. We've previously had conversations about transportation, housing, business safety, and some other things as well. And the next two that we have coming up will be on homelessness and on offshore wind. So we will have some great upcoming conversations as well. So how this works is we ask that all of our guests who are not our primary speakers to remain muted throughout the presentation. Chat is open, and we encourage you to go ahead, and if you have questions or comments throughout the presentation, please go ahead and put them in chat. And I've encouraged our speakers to, if they have time or have the right information, to respond to questions that pop up in chat in real time. Any questions that show up in chat that are not answered during the presentation period, we will bring them up at the end during our Q&A session. Let me see. So we do ask that everybody, this is a civil place, and sometimes we talk about contentious issues. So we do ask that folks remain civil. I have a couple of my colleagues in the background who will give folks warning if they are not being civil, and then folks will be removed if they're challenged. But we have never had to do that. So, but just like to give people a heads up that this is a space where we really want people to have a productive conversation. We do value candor and we do value openness. So that is definitely welcome. But if it becomes harassing, that's where our line is drawn. So let me see. I'm trying to think if there's anything else I need to say before we get started. Just for the agenda for today, our panelists will share. So first we have the three folks from Providence who will share, and then Nancy Stark from DHHS will share, and then Rosemary Denowden from Humboldt IPA will share. They'll be sharing some of the top priorities that are related to access to healthcare, and then after they present, we've got a couple of questions that, if they're not covered in their presentations, I've got a couple of questions that I will be asking them. And then we will open it up to questions that are presented via chat. So with that, let's go ahead and get started. So Michael and Dr. Goldberg and Basil, I'm going to go ahead and hand it over to you for the time being.
Great, thanks, Nancy. I'm new to Humboldt, so I'm laughing a little bit at your remark about people getting a little rowdy. I've had the opposite. So living in the Bay Area, I've seen the rowdy side. Everyone here has been very, very welcoming. Okay, so just to give you guys a little introduction, my name is Michael Kellerman. I'm the new CEO for Providence Health here at Humboldt. So that consists of, we have two hospitals, Redwood Memorial Hospital, St. Joseph Eureka Hospital, the Providence Medical Group. Basil, if you don't mind going to the next slide really quick. This is just a highlight of who we are, a little more specificity around St. Joseph Hospital. The next one talks about Redwood, just to give you guys a highlight and kind of combine these. So between the two hospitals alone, we have approximately 1,800 employees. So we're definitely a very large employer in the area. We have about 173 inpatient beds. On any given day, on average, we have about 100 patients that are admitted into our hospitals. So, out of that total bed capacity, we're floating just a little over 50% in terms of our capacity. We bring about 700 to 800 new lives into this community every single year, depending on the year, which is probably one of my favorite areas in the hospital. For those who are looking for surgical treatment and support, we perform about 11,000 surgeries per year between these two hospitals, which is fairly significant. In terms of some accolades and recognition, Providence St. Joseph, for example, you guys may have seen it recently, very renowned and amazing vascular program. That's through Health Grades. US News, we're also recognized as a high performer for orthopedic care, our colorectal cancer oncology services. Through Partnership Health Plan, they recognize us for our quality outcomes. And then one that's a big one for me is CMS, so Centers for Medicare and Medicaid Services. They have a fairly more objective tool now called the CMS Star Rating. Feel free to look that one up. I believe Redwood Memorial right now is a 5-star hospital. St. Joseph is a 4-star hospital, which, again, that speaks accolades to the work and the quality and the outcomes. So I'm going to hand off the rest of this to Dr. Goldberg and Basil. They've been here much longer than I am and can speak much more breadth about all the services and things we're doing around access.
Sure. All right. Thank you, Michael. So yeah, James Goldberg, I'm our interim associate chief medical officer. I've been in Humboldt for 4 years now. Prior to this, I was the medical director for both emergency departments for 2 years. So here we've part of what the hospital does is kind of ensuring that there's care that is ongoing outside of the hospital. So we have actually bolstered our case management team to help work with our skilled nursing facilities, kind of both locally and regionally. There's been work outside Providence Home Health as well, and working with transportation as well, so that we know that the patients, when they are discharged from the hospital, that they are going to appropriate places with appropriate level of care. So next slide. So one of the issues that is always brought up is recruitment of physicians to this area. Last year, we initiated this Destination Humboldt program, which is a loan repayment program to entice new providers here. And since then, we have hired 12 new providers since April of last year, both into primary care and into the hospital itself. Each primary care physician, you can see can care for 1,500 patients. So that's more access, more care for the patients in our community through this program alone. I can go to the next slide as well. And then we have our very robust care network, which is expanding care for the community outside of the hospital. It is focused primarily on those that are highly vulnerable, those that are kind of living on the margins here. Many are having substance use disorder, mental health conditions, and this is basically a community outreach that's helping to relieve the social burdens on people, to kind of help minimize the social determinants of health, to kind of help eliminate those, to allow them to become more self-sufficient, higher quality of life, and better health care.
Thank you, Dr. Goldberg. So I wanted to share a little bit about our outreach in the community, and as Dr. Goldberg indicated, those social determinants of health that impact the lives of our community and the services that our community needs. So we have 9 Providence staff members supporting 5 different centers throughout Humboldt County. And these service centers help people manage their food security issues. So we have had almost 12,000 food pantry referrals that came through our centers. 5,300 emergency food bags for families that were in dire need. We also provide the food in the backpacks for the kids when they're attending school, providing summer lunches. Also, we help with those clothing, hygiene, diapers, mental wellness referrals, social connections, and try to support the community at large to elevate the standard of living. As part of our care network, our focus areas are homelessness and housing instability, managing multiple chronic conditions, again, those social determinants, lacking basic needs, mental health challenges, substance use disorder, inadequate financial means to support their health, and language barriers. To help with that, we have providers through our care network that help manage chronic disease, particularly CHF and COPD. We also have a partnership with the health plan of Medi-Cal to help close those care gaps for the Medi-Cal population. As far as our perinatal work, we have behavioral health that supports our birthing people and through the care network. We also have an ED substance use navigator and ED behavioral health navigator. A lot of patients that present to our ED are really facing life challenges with substance abuse or homelessness. And these caregivers help with that navigation so they could get back into the community. We also are very proud of our work with homelessness. We help support Betty's House, the Healing Ring, and we recently opened and launched the Mother Bernard House. The Mother Bernard House, I believe, will be supporting 42 beds for our transient community. As part of our commitment and outreach in the community, we feel it's important to invest in our community. So something we're really proud of is our support of the Sorrel Leaf House. This is a new youth residential treatment center to impact this highly vulnerable and young population and get them on the right track. We also support the Betty Kwan, the North Coast grant making partners, and several other grant making partners throughout the community, as well as supporting financial support the Hospice of Humboldt to deal with those end of life patient issues, as well as supporting our school districts with staffing. So with that, that's our Humboldt presentation, and we look forward to the Q&A.
Just looking for my unmute button. So thank you all very much. We will have more questions for you as we move forward, but that was a great overview of things that that Providence is doing. So thanks very much for that. With that, we are going to move on to Nancy Stark with DHHS. She is pulling up her PowerPoint. I'm going to spotlight her so she pops up right at the top of your screens, hopefully.
Yeah.
All right, Nancy, do your thing.
All right. Hopefully I'm unmuted here. All right.
You're good.
Well, thanks so much for having me here today. I'm happy to be here to talk about healthcare access. I'm Nancy Stark. I'm the Legislative and Policy Manager for Humboldt County's Department of Health and Human Services. Been in this role for about 15 years, and prior to that, I worked for the State Assembly for State Assemblywoman Patty Berg. County Health and Human Services has a number of roles in increasing healthcare access. These are just a few of them. We enroll people into health coverage, including Covered California and Medi-Cal. There's about 60,000 people in Humboldt County who are enrolled in Medi-Cal. It's about 43% of our population. And this helps ensure that our providers like Providence get paid for the services that they provide to our Medi-Cal population. The county is also the specialty mental health provider for people with serious mental health needs and children with serious emotional disturbance. We're also a substance use disorder treatment provider for Medi-Cal patients. We have public health nursing, laboratory, communicable disease response, and environmental health. And we also connect veterans to healthcare services through the Veteran Services Office. I'm going to lift up just a couple of these to highlight some recent work in behavioral health. In 2020, the county launched the Drug Medi-Cal Organized Delivery System. Really expands access to a full range of substance use disorder treatment benefits to everyone enrolled in Medi-Cal. Prior to 2020, you kind of had to fit into these narrow buckets to access substance use disorder treatment services through Medi-Cal. You had to be kind of justice involved or child welfare services involved or pregnant or parenting. The organized delivery system has opened that up to any Medi-Cal beneficiary and a full range of services from detox and residential all the way through outpatient and case management. There's also been a lot of work recently in expanding access to mental health services. Back in 2014, the state expanded access to mild and moderate mental health needs for all Medi-Cal beneficiaries. That really picked up steam during the pandemic, and the state started to put more resources into expanding that access beyond people with serious mental illness. Same with the 988 National Mental Health Hotline. That's actually been in existence since 2005, but the pandemic really kicked it into high gear, gave it some resources to connect people to local services. The state also launched the statewide Children and Youth Behavioral Health Initiative during the pandemic. This is really a focus on children and youth and their mental health needs and embedding services into schools where children, youth, and families can really access those services. And Rosemary is going to tell us about some exciting work that her organization has been doing in that realm. The state also launched Cal Hope, which is really kind of that technology-based assistance for young people. Think text messaging, telehealth, those types of things. And they expand access to urgent mobile response. All of this, of course, takes workforce. Last year, the CEOs of our local healthcare organizations commissioned a behavioral health workforce needs assessment to kind of gather that quantitative and qualitative data to estimate the workforce needs of our region from Del Norte, Humboldt, Mendocino, and Lake counties over the next 10 years. And to really answer the question of what would a regional vision to expand the size, the scope, the resiliency of our North Coast behavioral health force look like. Out of that assessment came 8 strategies to work towards building our behavioral health workforce over the next 10 years. 6 of these are already in process. We're already working towards them. I'm happy to share this report and the strategies with chamber members, with anyone who would like to take a look at it. I'm going to highlight 2 capital projects that are really exciting, and Basil actually mentioned this just a moment ago. I love this one. This is called Sorrel Leaf Healing Center. And Dr. Buxbaum, who is a local psychiatrist, and his team are working to build a crisis residential treatment facility for children and youth ages 7 to 17. This beautiful house is on Indianola Road, right off the cutoff. It's currently under construction, and they hope to remodel the building, and they hope to start accepting patients beginning next year. And I will say that they do accept donations and on-site volunteers as well. And the second capital project that I'd like to highlight is the county went for a grant with Mad River Community Hospital, and we were successful in obtaining grant funding to build a 43-bed behavioral health crisis triage center on the Mad River Hospital campus. It's going to include a sobering center, crisis stabilization, crisis residential, and we hope to have that open and accepting patients in December 2026. And lastly, I just want to give a quick shout out and a heads up. The county is a sponsor to bring California Care Force to the Adorney Center this summer. California Care Force offers a full range of on-site medical, dental, and vision services for 2 days. The Reverend Tom Lewis, he's with the Unitarian Church and a retired dentist, is really the driving force behind this. And they are looking for additional sponsors, big and small. So if your business is interested in that, I'm happy to forward you the information. They are also looking for a day of volunteers. And with that, I'll stop and I'm happy to pass it on to Rosemary.
Great. Thanks so much, Nancy. I have questions. I have a couple questions that I will ask you at the end.
Okay.
I'm making my own notes if they don't come up otherwise from other folks. All right, Rosemary, go ahead, my friends.
Good morning, everyone. I'm just delighted to be here to talk to you about some work that we're doing through my organizations, the Humboldt IPA, the Independent Practice Association, and the North Coast Health Improvement and Information Network. I'm Rosemary Denowden, and I'm the CEO of both of those organizations. The IPA, we were formed in 1994 with a mission to ensure that Humboldt County and Del Norte County had access to healthcare services through our provider network. We are the administrators of several commercial health plans here in Humboldt County, and we do a lot of work to ensure that that access to care is available through our provider network. 99% of the providers here in Humboldt and Del Norte County are a part of our provider network, and our network reaches across all of California and the nation. A big part of what we do in the IPA and ENCHN is around the supports that individuals need to help navigate their care, whether it's care coordination or technology improvements to ensure that people are getting the right care at the right time by the right provider. ENCHN, the North Coast Health Improvement and Information Network, was formed in 2010. And we built the Health Information Exchange here in Humboldt and Del Norte County. And for those of you that aren't familiar with the Health Information Exchange, we have built all the pipes, if you will, between the electronic health records. So if you receive services at Providence emergency room, and then you go to your doctor's office, that data is seamlessly shared in real time to ensure that continuity and access to data. Over the last 3 years, we've been building out the Community Information Exchange, and that is bringing the rest of the data around what makes us healthy into that shared space. So if you need food support or housing, or you're seeing a therapist, or your child is in a school that's receiving services, all of that can be shared in a HIPAA and FERPA compliant platform that is enabled through patient or client consent. So really working hard across our two organizations to build the infrastructure and the supports that we all need, some more than others, to navigate what makes us healthy and to get to the care we need. So we do a lot between the two organizations. We've done a lot over the last 3 decades. I'm going to highlight three or four things. The Priority Care Center, that is our clinical arm out of the Humboldt IPA. We are a primary care practice that is integrated with mental health and care coordination and other supports. We primarily serve those members that have the insurance that we administer, but we have built a lot of programs over the years to serve everybody, regardless of whatever insurance type you have. One of those things is our shared decision-making center that is free and open to the public. The Priority Care Center is partnering with the Blue Lake Rancheria. And later this fall, we're going to be working with them to expand healthcare to Blue Lake. Blue Lake Rancheria has received some grant funding, and they are going to be opening medical services for their employees and ultimately for the community. And we are partnering with them to provide those services. There'll be medical, wellness coaching, navigation support. So really, really excited about expanding our Priority Care Center footprint in Humboldt County. The school-based wellness program initiatives that Nancy referenced, really exciting program. We are now in 12 schools across Humboldt County. We have wellness centers where students can come in if they need a break or a little snack if they didn't get breakfast, or just a safe place and an adult to talk to about what might be going on with them. Our team is trained in motivational interviewing and trauma-informed care, and are able to meet that individual where they are and address their needs. We partner with the schools to ensure that students and their families are getting those services so that they can be successful in the classroom. Because our ultimate goal is to keep kids in school so that they can reach their highest level of educational attainment. And because we know that if you graduate high school and if you go on to college, you are much more likely to have healthier adulthood and outcomes. So we're in 12 schools now, and that is expanding every day. Just got another interested school that would like to offer our wellness center and empowerment groups on their site. So really exciting work in the schools. And then finally, the community information exchange that I mentioned previously. This is a technology that Engine has built. We're not new. This is not a new technology. San Diego 211 is really the godfathers, if you will, of this. I like to describe it as the platform to help humans who help humans, right? So this is the infrastructure that if I'm a case manager, I can seamlessly communicate with other case managers that are working with our shared clients. I can make referrals to the food bank or to housing support so that I can really effectively help my clients. And I don't have to try to reinvent the wheel or try to understand what somebody else is already doing with my client. We are actively onboarding many organizations here in Humboldt and Del Norte County. We have 25 organizations that are live and about 100 that are somewhere between first demonstration and contracting. So we're really excited about the community information exchange. It's called the North Coast Care Connect, and having that ability to connect everybody that's working with humans here in Humboldt and Del Norte County and beyond. And then finally, and many of you on this call might be aware of this project because you're involved with it, but Redwood Region Rise is a fantastic opportunity for Humboldt and Del Norte County and Lake and Mendocino and the tribal lands. This is an initiative out of the state of California, California Jobs First, with the hope to build a 10-year plan for our region to ensure a high road economy, good paying jobs, sustainable economies for all of our communities, including Humboldt and Del Norte County. Engine is leading one of the 4 sector tables, the health and caregiving table. And there's 3 others: arts, culture, and tourism, working lands and blue economy, and resilient and sustainable energy. And these 4 working tables, along with many others, over 1,000 people participating across the 4 county and tribal land region, are coming together to identify what we need as sectors and our communities to ensure prosperous economies, prosperous communities into the long term. I've lived here in Humboldt County for almost 27 years. I raised my children here. I want to retire here. I would love for my kids and my grandchildren to come back. And this is the type of initiatives that we need to ensure that we can thrive here in Humboldt County. So thank you, all of you that are involved with Redwood Region Rise. If you want to be involved, please reach out to me. We are still recruiting to the healthcare and caregiving sector tables. And we would love for you to be a part of, what does healthcare and caregiving, so that's adult care, child care, disabled care, what do we need as a sector to ensure long-term sustainability? And there's real money coming from the state and others to support this work. So really exciting opportunity for Humboldt County around workforce especially. So with that, thank you. And take any questions.
Great. I just realized I was not muted, so you probably heard me typing questions into my computer. Apologies for that background noise. I'm going to go ahead and spotlight again all of our speakers as we enter into Q&A. There are a couple of things in the chat, but before we jump in there, I have a couple of broader questions that I'd like to ask. And any of you on this call, please feel free to directly ask your questions in chat, or if it's something you're not comfortable asking, go ahead and direct chat it to me and I can ask on your behalf. So I cannot resist asking this question. This was not on the list of questions that I said. Michael, so you are our new chief executive for Providence, and I'm just going to be candid. It's no secret that we've had a little bit of a problem retaining our chief executives at Providence. And all I know of you so far, I like you. I hope you stay. But what made you say yes to being in Humboldt?
Okay, that's a loaded question. So first of all, I'm staring out you can't see, but you guys ever watch the sun hit after a fresh rain? It's pretty amazing, and watching the water actually evaporate. It's a beautiful spotlight. But that's not why I came. So I'm aware of the instability. It was brought to my attention. I guess what I would say for myself, a couple things to that. One, Providence was kind enough to let my family and I actually just live here for 1 full week. No interviews, no nothing. It was just live there and see what your day-to-day life is going to be like. And I thought that was a really critical piece for us, because if you Google Humboldt, and that's something we can talk about as a community later, we are hard to find, or we are not reflecting the right part of Humboldt in terms of what I've experienced. Secondarily to that, we have a little 9-year-old son, and right off the bat, I'd say the educational resources that are here are amazing. The lifestyle is perfect for what my wife and I are into, which is surfing, going into the woods. We're doing that every weekend. And then lastly, I'll say I'm very focused on projects and having a vision and completing that. And so that's something we're starting to work on right now with the team. And I don't know, it's not a job to me. I live and breathe this stuff. The 2 individuals that are representing Providence probably already getting a sense of that. I'm on 24/7 and I love what I do. So I hope that sort of answers your question.
It gives us some hints for sure, Michael. So,
okay.
So you like it here. That's good. And
yeah, very much. Thank you.
We've had brief conversations about other ways we can keep you and other wonderful medical professionals and others here in our community. So there you go. Thanks for letting me hit you with that one. And I'm wondering, one of the things that I know is a really exciting opportunity and actual program at Providence is Destination Humboldt. You touched on it a little bit, but can you talk about where that started, how the community is involved in it? I know that there's been fundraising around it and such, and really exciting that your goal for the first year was to attract 3 physicians, and you got 12 within the first 6 months. It's incredible. Can you talk a little bit more just briefly about that and kind of highlight why that why you feel like it's been successful and what how the community can be involved.
Yeah, I'll let Dr. Goldberg speak to it in depth. He was a big part of instrumental of that.
Right.
Sure. So this was kind of part of a brainstorming session on like how can we attract candidates to Humboldt, because as Michael had mentioned, Humboldt can be hard to find. I mean, we all live here, we know how wonderful it is here, but people don't always know that. So we're trying to find ways to entice people to come here and to stay here. And this was one way of doing that. Loan repayment is huge for any position. The numbers for loans are astronomical, and any way you can cut into that and get some support with it is going to be welcome here. So it was a huge philanthropy effort. So everything had come from community and donations, and so really it was that really kind of drove this to be successful without having the funds there to have to help repay the loans. This never would have flown. So I think the community's contributions to this have been absolutely astronomical and have been greatly appreciated. And that is translated into 12 physicians and nurse advanced practice clinicians. I think they're all nurse practitioners that have all signed on to work here. We have had 2 nurse practitioners and a physician, actually one of our own residents here that signed on at the rural health clinic because of this as well. We have had 4 ED physicians that are going to be coming aboard because of Destination Humboldt as well. We have also had other primary care physicians, even coming from the residency, that have agreed to stay on and work in the primary care realm. As I say, it really has been a difference maker in getting physicians to this community. And the hope is that once they are here, they really kind of see how wonderful the people are here, how wonderful the area is here, and to see that they're really making a difference in a community that is kind of really starving for healthcare. What is there is good, but it's there obviously needs to be more of it.
I want to add just a small comment. And so when we talk about what our community needs, they need access to care. They need primary care access. And as Dr. Goldberg indicated, that's an additional, I think, 4 primary care providers that we signed on. That translates to 6,000 or maybe 7,000 visits community. And so it's been a tangible result-driven initiative, and it's leading to success. And those folks are working in the rural health clinic in Fortuna. And so we're going to see a lot more access in that community because of this program.
Wonderful. Keep it coming. So I'm going to ask a question that might be related to this, and that's around more specialty care. Do you foresee more specialty care coming to Humboldt? And a couple of people asked specifically about geriatric care.
Yeah, I saw that question.
Expanded geriatric care, so both geriatric and other types of specialty care. What is your...
So, I'm gonna share this response with Nancy and Rosemary, because I think we're all involved in this, in my opinion. I can say from the hospital side, this is something we're working on, and the short answer is yes. But we need to be very focused in terms of what this population demands. This isn't a build it and they come, right? It's a slow growth area, and I understand the maturation of the population is moving rapidly, and so we need to respond to that. And we're going to be honing in our focus on what does that subspecialty care look like for that population going forward. So short answer is yes from the hospital side. I don't mean to put you on the spot, but Rosemary, I feel like from your end, or Nancy, there's probably some areas that you'd be focused on as well.
Yeah, from our point of view, yeah, I agree. We definitely need more physical bodies, specialties in our community. But one of the initiatives that we're going to be launching in the next few months is around expanding existing capacity, especially for our advanced care practitioners. You know, providing resource through e-consult and other platforms and other technologies to expand the knowledge and the abilities of our existing providers, so that yeah, they won't be able to do everything that a subspecialist would be able to do, or, you know, somebody that is highly specialized in geriatric medicine, for example, but it will be able to expand their scope and their knowledge base so that they can more effectively treat their patients in many areas. So that's one of the initiatives we're rolling out across our provider network.
Rosemary, can you provide a scenario in
Sure.
which, you know, that teleconsult might come into play?
Yeah, you know, I don't feel that old, but you know, back in the old days, right? So back when providers really, you know, spent a lot of the time in the hospitals, and they, you know, shared the doctor's lounge. There was a lot of that back and forth around, you know, I have this patient that has this condition. Hey, neurosurgeon, hey, you know, orthopedic, what do you think? How can I treat this individual? So now that doctor's lounge scenario or passing in the hallway of the hospital doesn't happen anymore. So the e-consult technology is a way to replace that. Providers can submit a question, submit records to specialists at UCSF, Stanford, Mayo, beyond, and that specialist comes back with really quality answers and recommendations. And it's not just a one and done, it's a continual back and forth, so that that clinician can, you know, be better equipped and more knowledgeable around that specific for that patient and for future patients. So it's really replacing that curbside consult, if you will, that used to happen all the time.
Hey, thanks, Rosemary.
Nancy, may I just add really quick? I should caveat, some of the subspecialties do exist now. We have fellowship training vascular programs that can do something like what's called TCAR, transcarotid arterial revascularization, where they actually can tap into a femoral artery and literally reroute the blood for a carotid artery to do procedures to clean plaques, which is a stroke preventative measure. We have a neurosurgeon who can do, you know, pituitary tumors. We actually have some very highly specialized services now. But to your question, it doesn't mean that there aren't others that we need to get ready for.
Great. And Nancy, did you have something you wanted to add to that? And I'm going to check in with the folks who asked the questions about care for our elders, and knowing that our I think the word you use, the maturation, Michael, that you used, the maturation of our population. Very nice way to say that, because, you know, we're all heading there. But I wanted to check in with the folks who asked that question to make sure that you got answers that are helpful to you. And if not, go ahead and drop in chat what might be additionally helpful for you. Moving on to another question. Nancy, just a couple of things. When you were speaking, you talked about, you gave some examples of a research report that is helping to define priorities. And you said you offered to share that report. Is that a link that you could drop in chat for us?
You know, I don't think we've actually posted it online yet.
Okay.
But I will work to do that. And in the meantime, I can send it out to you to share with your group.
Great. And I will send that to everybody who is registered for this call. And then the other thing on the California Care Force event that's coming up, is there a way that we can help promote, you know, both, you know, through the chamber, through other folks who are on this call, because that's a fantastic resource for our folks who are socioeconomically underserved or resourced. So what?
Sure, absolutely. I am happy to connect you with Cindy from CareForce, who's working with the Reverend to bring the event here to see how best you can help advertise or sponsor or support the work. And it is for everyone in the community, not just those who are underinsured. It's for, they have a real focus on veterans and anyone who needs access to care on those days in July.
Great. So if you can send that, then everybody on the call, I'll include that in the follow-up email as well. Thanks, Nancy. Let's see. You touched on this a little bit. What is your approach to whole person and holistic medicine?
Who do you want to answer that? I was looking at Dr. Goldberg.
Whoever has
but-
all the answers. Mike.
Okay. Looking at the doctor, so.
There you
Oh,
go.
that's fine. So yeah, I mean, wellness is critical in any treatment. You know, you can give medications and say, here you go, you're going to be fine. But I think having support for having, you know, dietary, you know, education, you know, things like yoga, so forth, you know, this that are all kind of mindfulness. I think that is all like really, really, really important as far as treatment goes, because it's, I think we've all kind of discovered that it is not just, you know, medications that are gonna part of a person's treatment. That's only one aspect of it. There's a lot more that is involved, and sometimes can actually even be more important than that. So I think part of it is when we are, as I say, when we're looking at patients and we're kind of looking and discharging and so forth, we're trying to make sure that they're kind of getting hooked up with plans and services and so forth. They're going to be able to support those other needs once they have been discharged from the hospital. I know there's a lot of the community already that do kind of help with these sort of treatment. I'll call them treatments. It's basically what they are as well. That there are opportunities for, as I say, kind of their, you know, case management and social work, and you know, that whole team can kind of help work and ensure that patients are kind of getting the kind of wellness treatment that they need, in addition to the, you know, the traditional medical treatment that is required as well.
Great.
Just really quick, to add, yeah, I completely agree with Dr. Goldberg. What we know, the social determinants of health, right? So medicine contributes to about 20% of what will make us healthy or live longer. And so it's exceedingly important to determine what else is causing us to be unhealthy. So in our organizations and the work that we do, we promote and administer social needs assessments. Those are done in a lot of our practices across Humboldt County routinely. And I think for the IPA and Engine and all of us, right? So we have a good job, we work for a healthcare entity. It's really important for us to not judge a book by its cover, right? Because a lot of us are suffering from things that aren't apparent. So whether, you know, we might have domestic violence in the household, or teetering on the moment of becoming homeless because we're living paycheck to paycheck. A large swath of our members are that working poor, where, you know, any change in their income and they become homeless. So it's really critical that we are doing our patients and our clients that service by asking, what else is going on? Do you have enough food? Are you able to pay your bills? So that we can not only address the medicine that is needed, but also the other issues. Can we, you know, provide you some food resource or other supports? Because, you know, that remaining 80% is really what's going to improve our health and well-being, much more than medicine.
I love that answer, Rosemary. I just love it. I love this question too. And then connecting those services through the community information exchange so that we have a whole picture of what's going on in the person's life that we can work towards. I'm really excited about the community information exchange. For the county's part, I would just say that things like yoga, Tai Chi, meditation, nutrition, the kind of those complementary wellness activities are embedded into a number of programs across County Health and Human Services. The one that really stands out to me is our TAY division, the Transition Age Youth Division, that works with young people ages 16 to 26. They work with our local tribes to bring kind of indigenous wellness practices to young people. And they hold an annual wellness week that highlights the 8 dimensions of well-being. And to really kind of lean into those practices and start those at an early age. So just some really exciting work happening in kind of that complementary wellness space.
Hey, thank you. I'm going to circle back to the question about geriatric care. There were some great responses to the larger question about specialty care, but you know, one person asked, I have an 81-year-old mom, and I think she moved here a few years ago. And this isn't me, but this is my friend Sue. And the care options for older adults can be, especially as they need more specialty care, can be a little bit more sparse than we would all like. You know, and along with that, you know, I'm sure cardiology was another question. You know, how do we get a cardiologist who stays here for more than 6 months? You know, I've seen that, you know, with my own family. Somebody needed to see a cardiologist on an emergency basis and still had to wait 4 or 5 months on an emergency basis. And then when, you know, 2 more cardiologists later, there was no cardiologist for follow-up. So how are you, so that's kind of 2 questions related, I guess, but how are you specifically making steps to improve geriatric care in our community? Because especially as our population ages, it makes it a little bit more difficult for older adults to travel to Santa Rosa or UCSF, you know, things like that.
So let me address a few points there, and then I think Dr. Goldberg, I'm gonna lean on you as well for making sure you clearly differentiate geriatric versus internal medicine. So first and foremost, geriatric medicine, in my humble opinion, not clinical, so Dr. Goldberg, feel free to correct this. It is a primary care physician by training. There's internal medicine and family medicine. Internal medicine is typically the better focus because they have more clinical hours and a greater understanding to deal with more complex types of situations. The geriatric piece from that area is more about experience and making sure that we have the right physicians in this area, and then that physician, that primary care base, has the support around them to actually make sure we're navigating. The other piece you're touching on is, you know, transportation, right? And I think Rosemary and everyone touched on that as well. And that's why I think the representatives on this panel you have, it's so critical that we work together as a team, because we each have a facet in that. And so that was touched on is how, okay, great, we have the doctors, great, you have the subspecialists, you have all the faculties to take care of this population. They can't get there, or there's no one calling and checking in on them to make sure they're okay and that they're being taken care of. So that's part of it. The cardiology, or just the overall retention piece, there was another question that came up, I believe, from the chair of the chamber. I forget your name, sir. I saw your question though, and it was, you know, how can the chamber help? And that goes again to the retention piece. One of the things that I will be engaging with the chamber on is we deal a lot where physicians will still come in and 2 things happen. One is, hey, how do I find my tribe? And 2, I have a partner with me. How do they find their tribe? And so I think where the chamber and the community could be helpful is where I came from in San Luis Obispo. We had a program where we would connect any incoming candidate, maybe a physician, a caregiver, whomever it is, and we connect them with the chamber. And the chamber is, how old are your kids? What kind of education are you looking for? What's your local church? What are you into? And they help connect them into the community, because it's very hard to penetrate into a community. The second piece to that, though, is also trying to help them find for that trailing partner. If that trailing partner is working and they have a career, whatever that is, collect those CVs and keep track of what opportunities exist. You know, areas like our community, Humboldt, is very grassroots. And, you know, you're not gonna just find postings. So to have somebody who can help navigate that, I think those will go a long way in helping us retain the providers and the caregivers we've brought into the community.
So, yeah, I agree, Michael. I think we're putting a lot of work into bringing people here. I think there needs to be as much or even more work done to help keep them here. And so I agree with the approach that you just described. I think we just got to kind of multiple times on our end here. But as far as kind of like treating geriatric patients here, there is a specialty in internal medicine where there's like geriatrician, but it's even then the numbers on those are low. Like their availability is difficult for anywhere. So really, it kind of goes back onto the internal medicine, family medicine. Internal medicine probably would have a greater focus, at least as far as like geriatrics. They really are kind of not dealing too much with actually they're not dealing with pediatrics at all. So if the family medicine physicians that are dealing with life from pretty much birth till death, through all phases of life, and really what we want to see is that the primary care physician is exactly that. They are the primary care provider for that physician, where kind of everything is kind of orchestrated with them, and then to have the kind of support outside of that. I think sometimes I've heard it's like get lost. Well, I need that specialist. I need that specialist, and I think really what we need to do is kind of make the primary care physician the specialist, and then when you really need that other care, you kind of reach out. So Michael did mention earlier to say that we're kind of really looking at the community needs, and there is a community needs assessment that is done as far as kind of what do we need now, or what are we going to need in the future. Geriatrics is one of those, whether it's cardiology, GI, oncology, it's those kind of specialties that you're kind of looking for. So it's we are kind of looking at that both short term as well as long term, as far as how the hospital can support those the needs for the geriatric population.
Yeah, and our latest community needs assessment shows primary care, that's internal medicine, family medicine, and peds. We have provider shortages above 20, right? And for such a small community, that's a lot of physician resources. And so, programs like Destination Humboldt and other items like that are going to need to be launched to get physicians in the area. So it's about recruitment, getting them here. I think that's our challenge as a community. And any initiative that closes that gap is what we need to focus on.
Great. I'm going to head back to questions in chat. One of them is, how do the residents of Humboldt County that do not qualify for Medi-Cal services and pay for their private health and dental insurance find a primary care provider? And I think that that's probably a question even for those of us who do have employer paid healthcare healthcare, or even partnership or something like that.
I'll take a stab at that one. We're the administrators of many of the commercial plans that are offered in Humboldt County. So for anybody that has private, an Anthem or Blue Shield or other, the IPA, we're here to support you in finding care or to navigate the system. We developed the Priority Care Center 8 years ago because we were finding that our members were having a hard time finding primary care. So not only do we offer that primary care service, but we also offer same-day care. So kind of a pared down urgent care for all of our members, whether or not we see you for primary care or not. So I would say call the IPA. If you need help navigating or finding a primary care provider, our team is here to support you. And it is hard. We know of a lot of people that are living in McKinleyville and having to drive to Scotia or Garberville for care, which is kind of outrageous, but they're able to get to the care, when we are lacking access for sure. But we can help at least navigate that a little easier if somebody is struggling.
Great. Can you put your website or wherever people can go to?
Yep.
For that, drop that in the chat. Thanks. And I had a couple of other questions came up for Rosemary. I will admit one or two of them may be mine. Can you talk about 211 in Humboldt? Is there an active 211 system?
Yeah, there is a 211, and if anybody has any suggestions, we would love to talk to them about the work that we're doing in the Community Information Exchange and Engine. They provide a pivotal role here, and we would love to get in touch with them. And we've been wanting and trying for some time, but they're not directly involved with our work yet. So if anyone in this room has some suggestions, I'd love to take those.
Right. And for those of you who don't know 211, it's a number that anyone can dial to get access to information basically about social services, including healthcare. I know I've been in other cities where it's been a really vibrant resource, and actually worked for an organization that ran the 211 system in Sacramento. So, it's vital. It's a really important resource. So if anybody knows.
Yeah, I would agree with that. And I will say that a part of our community information exchange is we built out an online presence. It's called the North Coast Resource Hub, which is very similar to what 211 provides over the phone, but this is a website where you can, are you looking for childcare in this town for this insurance type? And it will curate a list of providers that offer that, and many, many topics. So North Coast Resource Hub, I'll drop that in the chat as well.
Thanks, Rosemary. And then on Redwood Region Rise, you said that Humboldt IPA is helping to facilitate the healthcare sector on that. What are the other sectors on Redwood Region Rise?
Arts, culture, and tourism, working lands and blue economy, and then resilient and sustainable energy. And again, across the 4 counties and tribal lands, Humboldt, Del Norte, Lake, and Mendocino.
Yeah, and I know that there's kind of a subcommittee on equity as well.
Correct. There's a tribal table, an equity table, and then a local table. So each county has a table, and then we have the sector table. So this is a huge project. Thousands of people are involved.
It's complex, but it could bring a lot of resources to our community. So switching gears, currently outpatient labs are collected at LabCorp and sent to San Diego for testing. How long a delay is there before results are available to providers and patients? Is LabCorp able to accept electronic orders from providers? Is there any plan by Providence to restore outpatient lab services here?
I'll take that. So a few things there I've touched on there. First and foremost, yes, so everyone's aware, Providence Health is already utilizing LabCorp for a lot of its inpatient lab processing services. So on the inpatient side, the hospitals and whatnot are already integrated through Epic. So Rosemary earlier was talking about like the pipes. So those pipes are connected. And they'll be connected on the outpatient side too. So if you go to a Providence Medical Group primary care physician or whatever, they'll put their order in electronically, and then the order will be coming right back into their medical record, as well as anyone here who uses MyChart. You'll see your results. You shouldn't feel a difference. You really should not. The hospital has contracted services with LabCorp. So for anything that is considered a stat order that needs to be turned around in less than 4 hours, if you are receiving services within hospital outpatient departments, like if you're within our oncology department or you're going to go get surgery, all of that will still be processed here within the hospital. That won't change. The one that will change, and you may notice a little bit of a difference, is let's say you go to your primary care and they need to do, hey, we need to do, just want to see an overall blood count, general lab draw, kind of get a sense of what's going on, cholesterol, et cetera. That is going to be transitioned out, where maybe some of us were seeing that processed, within a few hours. Now that may be the next day. So the other thing I'll add to your question is, are we going to maintain services when we bring it back? For a little bit of time, Providence is going to maintain redundant coverage. So if for whatever reason LabCorp is not maintaining the hours of operation that are needed for the community, or they're just lapsing, we're going to have redundancies in place to make sure that there's no disruption in access. Secondarily to that, we have an agreement with LabCorp, we being Providence, where we're going to be identifying key metrics for quality. So that's going to be turnaround time, results, and we're going to be monitoring that. And that means that we have an ability to speak with LabCorp and help kind of guide them to either, hey, you're not meeting, what your mission is, and you're not delivering the care that our expectations in this community. And they either need to come and meet that demand, or we will have a discussion about potentially re-engaging our services.
Great, thanks, Michael.
Just one more comment regarding order entry and ability to interface with LabCorp. The answer is yes. LabCorp has a lot of existing interfaces with the small independent practices and larger practices. And if they don't, Ancient has that interface, and it can help anybody build an interface to where they have that order entry and result interface capabilities.
I want to, for our speakers, we've got about 20 minutes left, which is great. But I'm seeing more and more questions being added to the queue. If you want to address those via chat, you certainly can. And we'll save the chat and, send that out to folks as well, so they have those answers. Another question that's come up is, and there was some conversation around it, is about, and says, especially for Michael, about the relationship or interaction or support between Providence and neighboring FQHCs and rural health clinics. And I don't know what FQHC is.
Federally qualified health clinic, so open door. Let me get rid of this chat thing. Gotten so used to Teams, Zoom seems clunky now. It's funny. So, and I'll let Dr. Goldberg probably speak to this a little more, but I'm still kind of getting up to speed, but I did meet with Tori Starr, who I believe is the president and CEO of Open Door, and we do have relationships with them. We actually lean on them. Hospitals in general lean on federally qualified health clinics immensely. They are an access point in the community. They seem to have a very robust presence in this community. Some of our partnerships with them fall around maternity care as well as our primary care in terms of our residency program. So we have a relationship right now with Open Door and maternity services, where they offer a lot of the OB access points. We help cover, though, for any call, for any emergent situations. We provide our services in our OBGYN footprint to help in that area. And then I hope I'm not misstating this, Dr. Goldberg and Basil, but I believe we had, for anyone who doesn't know, Providence has a family residency program. It's a 3-year program where we actually have family practitioners coming in as students and residents, and boots on the ground, taking theory and applying it to the actual role of being a physician. And I believe that through partnership with Open Door, those residents have access to those clinics as well, and they rotate and have experience in there. Is that correct?
That's absolutely correct, Michael.
Okay.
So we're very proud of that work with Open Door. I think our current cohort is 21 residents, and those are family medicine residents. And what's exciting about that is leveraging Destination Humboldt, keep them here after they graduate. We're very successful in signing several residents to stay here long-term and create primary care access for this community. So that's a wonderful example of our partnership and collaboration with the federal qualified health.
Yeah, we actually, just to clarify what Basil said, there's actually been 4 residents so far that have stayed in the community as a result of this. And the residency has been successful in attracting candidates to the point that they've actually expanded it by another slot for this coming year. There was 6 residents per class, and starting this coming summer 2024, there's now going to be 7. Match day, which is when medical students and residencies know when, who is going to what residency. We've already been notified that all 7 spots have been filled here, which is just fantastic news. I think the important thing that I think everybody, at least in the healthcare community here, has realized is that we are all dependent on each other. This is not a competition. It's like we support each other because the community needs it. So there is a lot. There's a lot of collaboration with Open Door, Mad River, Gerald Phelps. I mean, it's just, and it's because it's absolutely necessary that it happens. Otherwise, healthcare in this community will completely fall apart.
And just an added point, I think our residents completed, I think, 17,000 visits in that clinic. And so that's a lot of access for our community locally here.
Great. I think we talked about this. I think, Michael, you addressed this, the question from Ross about how can the chamber and business community support Destination Humboldt to make transition for these professionals into Humboldt as seamless as possible. Sounds like the chamber has a new project with Providence. Let's see what else. And I see some other.
You could always write a big check too. That's very helpful.
Say that again.
You could always write a big check. That's very helpful.
There you go. Absolutely. I see that Aaron Young as a contact at the foundation, and the Women for Wellness is a great way to get involved.
Yeah.
That Aaron also supports. All right, next question. What is the retention rate for individuals who are providers and have loans? What's the retention rate for them after they fulfill their obligations, their basic obligations?
So literature.
I did put an answer in the chat
Okay.
for this.
Great. Just scroll down.
All right.
All right, cool. So 4 years, their 4-year obligation.
And Nancy, literature indicates if a physician stays for 3 years, they're likely to stay for 10 years at almost 70%. So that is so you'll keep the doctor here.
Yeah.
And I would also just add that the tracking with what Basil just said, Partnership Health Plan, the managed care plan for Medi-Cal beneficiaries here, they've invested millions of dollars in provider recruitment and retention bonuses over the last 10 years. Their numbers that they've brought about 128 providers to Humboldt and Del Norte counties over those 10 years. That includes 54 MD physicians, doctors or DOs, 65 advanced practice, so PAs, RNs, nurse practitioners. And it's largely signing bonuses rather than loan repayments, but their success rate at retention is about 70% at this point. So it kind of tracks with what Basil was saying. And it's not loan retention, it's signing bonuses anywhere from $4,000 for substance use disorder counselors to, I think it's $120,000 for physicians. And then they have retention bonuses for practitioners who have been here for 15 years who will agree to stick around for another 5 years. And that's worked at a little higher rate than 70%. So there's different strategies. And it pretty much tracks with what Basil just said.
Great. So I think that's the end of the questions in chat. I have a couple of questions that haven't come up yet that we had discussed. Can you talk about increased access to dental and optometry care?
That's that one, probably Rosemary and Nancy, I think, better than us.
Yeah, I don't have any information on that.
Okay.
I don't either, other than dental. We don't have oral surgeons here that will work with Medi-Cal patients who have patients who have Medi-Cal and require dental surgery. So they're largely going out to Santa Rosa, and Medi-Cal will pay for transportation, which seems like a huge cost compared to, actually having an oral surgeon here who will accept Medi-Cal.
And Nancy, I know that we supported a grant for free dental and vision clinics in Fortuna. That was the AHF North Coast grant making partners. I'll see if I could reach out and get some more information on that resource.
Great. Okay, thanks, Basil. Touched on this just a little bit, and then I've got one big last question for y'all. How are, each of your organizations expanding care, access to care by using alternative means such as telehealth or mobile clinics? You touched on it a little bit, but a little bit more specifically, how does this fall into the equation of increasing access?
So I'll say from the Providence side, there's both of those, mobile and tele. So tele is huge, especially in areas like where we are here in Humboldt. We use it for a lot of subspecialty consultative care, after hour critical care, neurology. I've seen it used for gastroenterology, cardiology follow-up. It actually has a lot of application. It is interesting though to see how that shift in that paradigm, right? You remember right after COVID, it was telehealth, everyone's doing telehealth, never going to an office again. Yeah, kind of shifted back. And I think as you see populations like ours, where they have more chronic conditions, you do need more in person, but telehealth has a huge faculty on the hospital side. And then I know not here in Humboldt, but I know Providence in Santa Rosa area, they actually do have mobile clinics where they go out into the community to take care of those who are unable to have access to care. It is focused a lot on preventative and primary. And as I'm speaking this, I actually am questioning if they do dental, but I have to find out about that. And maybe that's something we can look at down the road here as well.
So I will say that actually Open Door has a mobile clinic that it goes, pretty much around the county to provide care. It's mostly kind of for the homeless population, but that is available as well. Yeah, we're using telehealth for consultations in the hospital for services when we don't have inpatient. I think that's it's going to be a big modality kind of going forward. But as I kind of mentioned in the beginning, I think having the care network that Providence has as far as going the outreach into the communities to help, to provide care and ensuring people are getting their medications and helping with lifestyle and so forth is another big part of this as well. Especially for those that have like difficulties kind of coming to the hospital or kind of coming to a primary care provider, so we can kind of help them out in the community as well. And I think that is, while not like it's not new or it's not new or like innovative, I think it's in our county, I think is really, really important as well.
And to add to Dr. Goldberg, there's been a extensive expansion of telehealth for psychiatric patients. So there's a lot of visits that you see with your counselor, your psychiatrist, that connects resources in other cities and areas where they have a population to support a lot of psychiatrists to local rural communities. So that's very exciting, and we really saw that expansion during COVID, and it's continued to today. I think psych televisits are around 30 to 40% right now. So total.
Really quick. Open Door and Redwoods Rural down in Redway have mobile services for dental and physical health, and both of those go into schools. So you might have noticed a banner on a school in your neighborhood that says dental services coming soon. They've had a long history of providing dental in the schools, which is fantastic. For telemedicine, again, promoting that e-consult technology to, build out the knowledge for our existing provider workforce. And we at the IPA, we contract with a telemedicine vendor for our members to have access, but we also help members and individuals navigate what other access they might have around telemedicine. whether it's, I have a specialist down in the Bay Area, can we help you get that visit through telemedicine rather than you driving 10 hours round trip? So helping them really coordinate accessibility through telemedicine. And also, many of the commercial and Medi-Cal provide telemedicine through as a benefit. So really making individuals aware of what resources they have through their insurance. And that's typically on the back of their insurance card, things like MD Live or telehealth to you, just a cadre of services that are made available as a benefit that people don't realize.
Thank you, Rosemary. Absolutely hit a couple of the points that I was going to make, and same with Basil. We do use telemedicine for kids and adults in county mental health. And we have worked with Southern Humboldt with Redwood Rural Health Center to build out a street medicine program, which is new to Southern Humboldt. Mobile Medical's been doing that throughout the county, mostly in the northern and eastern regions for decades. So we're excited to help bring that to Southern Humboldt as well. And telehealth works great for people who choose it and who have access to broadband. So it's not for everyone, but it has absolutely increased access. Teenagers in particular seem to really like it. They like text-based mental health and they like telemedicine.
It's weird teenagers.
All right. Next to last question. How are CR, Cal Poly Humboldt, and other workforce development programs preparing to better meet the demand for more healthcare workers? And who has their PowerPoint ready for that? So
I'm happy to share a couple slides, but I see that we do have Dr. Flamer here. So that's really who should answer the question. And Dr. Flamer, I'm just gonna show a slide of the healthcare hub while you field that question.
Oh my gosh, that is. Oh, there you go. Go ahead and start talking and I'll fill in the blanks after.
All right, well, this is just an exciting capital project that I happen to have a slide from Cal Poly was pleased to help me out with this. So this is a warehouse that is on Samoa Boulevard in Arcata. It's about a mile from the Cal Poly campus. And CR, my understanding, and Dr. Flamer, fill me in, but my understanding is that this is a joint project with CR and Cal Poly to build a really cool healthcare education hub and program that goes along with that. This warehouse will be converted into a clinical skills labs with virtual reality simulations and immersive simulations for a wide variety of healthcare programs. And let me see if I can get it to advance here. Some cool pictures. They are using a Kaiser facility called the Garfield Healthcare Center, Education Center, as kind of an inspiration model. And Garfield Kaiser has a really cool virtual tour through their facility. And I'm happy to share that with this group to try to get a sense of what this beautiful new facility, complete with virtual reality training, is going to look like on Samoa Boulevard. And I'm just going to turn it over to Dr. Flamer to talk a little bit about the Redwood Coast K through 16 collaborative that's been working on supporting local students in a journey to choosing a healthcare career. And I'll go ahead and stop sharing, and I'm happy to send out those really cool slides that Cal Poly helped provide today.
Wow. Thank you so very, very much. Number one for the question and great answer too. Wow. Thank you very, very much. So yes, so we expect the healthcare hub to actually be all set to go by January 25. So we are right in the process right now of costing it out to make sure that there is enough money in the budget our hopes and dreams for that area. So we're very, very close to finalizing that. So we are going to move all of our healthcare programs out to this hub. We have already approved to bring on 5 or 6 additional allied health programs, and we will implement those over the next 2 years. So right now we are in the process of identifying budget, but also trying to identify faculty who can write the curriculum for us to get those up and running. And so we are going to rely heavily on Providence, quite frankly, to help us get our curriculum and our labs up to date. We're also pushing very hard to expand our cohorts. So we have enough money set aside to expand our cohorts, both in nursing and other allied health. Again, but the key piece there is finding enough faculty to teach in the classroom. That's really the only problem that we have, is just to find faculty. So the K through 12, K through 16 actually, we're pushing very hard to work with our partners to boost our dual enrollment and concurrent enrollment in healthcare areas. So high school students and grade school students can get somewhat familiar with what's going on in healthcare, so they can get their minds set on all the coursework that they have to complete in high school to be able to realize their dreams in healthcare as they go forward. So that's a very quick overview, kind of quick answer to your question.
If I could add to that, there was an earlier question about how do we keep people here. That stuff you just heard contributes to that. So imagine that warehouse you're talking about and that kind of faculty to have that kind of offering. Those are things that people are attracted to. What Dr. Flamer was talking about in terms of expanding, the ability for externships and getting people interested at a younger age, not only keeps those who are here, but you heard Basil and Nancy talk about people who come for these programs and stay in a certain community for at least 3 years, I think was the statistic. 75% tend to stay. So to get people into these kind of educational access points through Redwood or through Cal Poly, I came from a small little town called San Luis Obispo, and that town over the last 20 years, you can't recognize it. And it's because of everything that you were just talking about, Dr. Flamer and Nancy.
Yeah, and we're super excited about the partnership. I know our CNO Nate Yu is working diligently to help support staffing for these enlarged cohorts, and it's been a very successful program. I mean, we had 38 TIPS nurses transition into practice nurses here, and we hope to grow that. So we stop counting on travelers to come into our community that are constantly coming in and going. We need to stabilize our healthcare, and this work that Dr. Flamer is doing is going to be very paramount to that. So.
Right. Thank you, Dr. Flamer, for being our special guest speaker today. So we are at time, and I see just one more thing. Oh, Kim from the mayor of Eureka. Thanks for all the great work happening. Thank you for your time today.
That was gonna be a big question there from the mayor. I was like, ooh.
Yeah.
Concluded.
We'll hunt you down.